This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubeda Hamid, your host for today. The wellness sector is booming in India. Aesthetic skin and hair clinics are everywhere, social media feeds are filled with advertisements, and procedures such as hair transplants, skin lightening, Botox, and others are becoming increasingly common. In a few cases that have been reported in the news, however, some of these treatments have gone horribly wrong. In May this year, 2 men from Kanpur died after botched hair transplants, and another man in Kerala contracted a serious bacterial infection. Experts say that the problem lies in the lack of regulatory oversight. Who is supposed to be able to perform these procedures and who is actually performing them in India? Are clinics where these procedures take place fully licensed and equipped to deal with emergencies? Are misleading claims and exaggerated advertisements contributing to the problem? And what is being done to ensure patient safety? We are joined today by Dr. Rajetha Damisetty, a senior dermatologist based in Hyderabad and national chairperson of the Indian Association of Dermatologists, Venereologists and Leprologists Committee on Anti-Quackery, Legal and Ethics. Welcome to the Hindus in Focus podcast, Dr. Rajetha.
Thank you.
So, Dr. Rajetha, let's start with the number of a whole host of aesthetic, skin, cosmetology, hair centers have sprung up in India over the past 2 decades. Tell us, what do you think has led to this spike in these numbers, and what is behind it?
So, a cosmetology is basically what a beautician practices. And the rise of salons, spas, and these beauty parlors, as we used to call them at one point of time, has been happening for over 2 decades or so. And I think the main reason is, the rise in disposable income, the focus on looking good, the social media coming into our lives. I think, the very fact that people are just being photographed all the time, photographing themselves all the time, all these have a lot to do with the rise of cosmetology centers. Now, regarding the aesthetic centers, or if you want to talk about skin hair clinics, there you have the medical component coming in. And yes, there has been a huge explosion in the past few years. And the reason for that also is kind of similar. It is the demand. Also, the main problem that we face as doctors, as dermatologists, is that once you start using this term cosmetology loosely, like it is used extremely loosely in the country at this point of time, lines are getting blurred, and a common man or woman doesn't really understand that cosmetology is not a medical specialty, that a medical specialty's scope in terms of skin hair treatments is one thing, whereas a beautician's is another. No, logically, if you think of it, you think, okay, beautician does this and the doctor does something else. But then there's a lot of confusion that is being created. And the reason for the rise of these two very different kind of clinics is the same. It is the demand, but also it is the supply. Skin and hair clinics have been increasing because now we are 18,000 dermatologists in the country. And if you add plastic surgeons, then there's so many. But one of the main reasons for this increase in skin and hair clinics is the fact that many unqualified people actually have started opening them. So there's been, like you said, a host of them opening in the recent past.
Doctor, you made it very clear that there is some things that a cosmetologist does, which is the beauty treatments, and another thing that the dermatologist does, which is medical procedures. Tell us, what are the kinds of treatments that come under the scope of one, and what are the treatments that come under the scope of the other? And why, as you said, are the lines being blurred now?
So cosmetology is basically what happens in a beauty salon. So haircut, hair color, nail art, maybe a gel manicure, a pedicure, hair straightening, keratin treatment, cysteine treatment, makeup, waxing, threading, those normal salon procedures that someone would go to a beautician for or a hairstylist for. That's what cosmetology is. And the government of India has decided, as a part of their vocational training program, that a 10th class pass is what is required for a cosmetologist training eligibility. So the government of India has made it quite clear. Now, regarding what a aesthetic dermatology procedure means and who should be doing it. So, if you talk about a chemical peel, a laser hair reduction, a pigment laser, a tattoo removal, or you have some kind of a pigmentary concern, or you have acne scars, and you want a treatment for that. So there are various kinds of treatments. You want a micro needling done, a micro needling radio frequency done. So grossly we speak about three categories of these aesthetic dermatology procedures. You can talk about peels, chemical peels, or lasers, or energy based devices. And then we talk about injectables. So injectables like Botox, which is a brand name. It is something that a company called Allergan produces. There's something called Dysport, which is also very similar molecule. So this is one category. And then you have those fillers. And then you have something called PRP, platelet rich plasma, which is made out of the person's own blood after separating out the red blood cells. So all these are medical procedures, and they need to be done most of the time by dermatologists, though there is a blur and overlap with what the plastic surgeons do as well. And I am talking about the use of these in the skin. Now, something like PRP, platelet rich plasma, could be used by the orthopedicians in a knee or the shoulder. It could be used for a host of things. It's being used by gynecologists for certain uterine treatments and things like that as well. Sometimes they use it for certain conditions of the genitals, the vagina and all. So that's a different story. So I'm talking about mainly the aesthetic concerns. And even here, the point you raised was a very valid thing, because where does a treatment end and beautification begin? Like, where does a desire for uneven skin tone correction end, and where does the treatment of a problem in the skin which is leading to uneven skin tone begin? So this is a very tricky situation, which is why it is best that the dermatologists do this. Now, okay, I guess in our subsequent conversation we will explore in depth.
So you made it very clear that there are these procedures that should be carried out by qualified medical professionals, dermatologists or plastic surgeons.
Absolutely.
But what is happening now, and what some states have begun to see, and some incidents are beginning to come out in the media as well, is that people who have gone for a hair transplant that has become botched, or people have gone for some sort of skin or anti-aging therapy that has had a bad consequence because their health has been affected by it. And eventually, the police have found out that these treatments are being performed by practitioners who perhaps do not have all the qualifications they need to. So, what are the legalities around this? Who is supposed to be performing these treatments, and who is actually doing so in India?
So, legally, the NMC, that is the National Medical Commission, has made it quite clear that hair transplantation and facial aesthetic procedures should be done by dermatologists and plastic surgeons, and that too after they have a certain kind of infrastructure and they've had certain kind of training in their curriculum, or maybe after they have completed their degrees, for the ones who finished their training earlier days. Now there is one bone of contention here. The DCI, that is the Dental Council of India, had brought out a circular in 2022 December, which said that a particular specialty of MDS dental surgeons, that is called the maxillofacial surgeons, oral and maxillofacial surgeons, that they can also do this. And this is something that is sub judice right now, because two dermatology associations have challenged this in the Madras High Court and in the Bombay High Court. And even the Dental Council have made it pretty clear that none of the BDS people are supposed to be doing anything related to skin and hair. And they have also made it quite clear that the word cosmetology is not what they want their dentist to be calling themselves. And we are very grateful to the Telangana Medical Council and Telangana Dental Council for having brought out such clarity in these, because it was kind of lacking till that point of time. This people started calling themselves cosmetologists, and then when you see Dr. so and so cosmetologist, then you're not quite sure whether this person is a medical doctor or a dental doctor or even a Ayush doctor. And somehow people understood it as somebody who was equipped and who was licensed to do these aesthetic facial procedures. And that was where actually quite a bit of the confusion began. And I'm glad you brought out this botched up hair transplants and all. I'm sure you and many of the listeners would know that in Kanpur in 2024 November and 2025 March, two engineers in their 30s had died, and after a hair transplant, and both these hair transplants were actually done by the same lady who was a BDS doctor. So that was very unfortunate. So it is not always minor side effects that may ensure. Sometimes things can go seriously wrong, which is why I think people should be very vigilant in choosing their healthcare provider and even their aesthetic service provider. And in both the cases, it better be a qualified doctor.
So as it stands now, who are all of these practitioners? The skin, health, aesthetic clinics, hair transplant practitioners, who are all these people? Are they all qualified dermatologists or plastic surgeons in our country?
Unfortunately, no. So the ones who are eligible to have this, as per the NMC, are the dermatologists and the plastic surgeons. As per the DCI, at this point of time, the oral and the maxillofacial surgeons also are eligible. That we have challenged anyway. That's a different story. But most of the time, you have these three categories of people who are doing this. A very large category are the BDS dentists who have acquired these so-called cosmetology qualifications, or they've done some kind of a diploma or a fellowship. And when you go into the depth, you'll realize that many of the time it is a online course, or it is some kind of a few days of contact classes. Sometimes it could be as short as a weekend or a 3-day or a 7-day course as well. So this is one major category. The second category are the Ayush doctors. So whether it is Ayurveda or homeopathy or Unani, who also get into this kind of a cosmetology trap. And then the third one is somebody without any medical or allied specialty qualification at all. Yeah, you also have a physiotherapist at times getting into this. Or you could have someone with maybe a 10th or inter or a BA or a BCom or a MBA, or it could be anybody at all who started off with this. Because there's so many fake doctors out there. There's so many real doctors out there whose specialty is not medicine. Because when you do your dentistry, then also you are obviously given this prefix of DR, doctor, and you're addressed as a doctor, but then that is a dental doctor. And then if you're an Ayurveda person, then also you're called a doctor, but then that is a different specialty altogether. So these are the three categories: the dental professionals, the Ayush professionals, and then people with no apparent qualification that could be even remotely connected to a patient care. So these are the three categories.
You mentioned that a lot of people are doing these short-term courses. Are any of these courses approved of by the NMC? Are they courses that you are allowed to do and then allowed to practice, or is it just ad hoc?
None of them, not a single one of them, is approved by the NMC, or for that matter, even by the DCI. None of these are approved. In fact, what's been happening is, there is so much of overproduction of dental professionals, Ayush professionals, even MBBS doctors, and it's very difficult to get into a postgraduate specialization course for many of these people. And the kind of employment they get is not really what a dental professional or a Ayush professional deserves. So these people go around looking and they get trapped by many of these centers with which have their own selfish dubious interests actually. And now, are these courses allowed? Basically, that is one of our biggest flaws in the regulation. This regulation of, who can start a fellowship, what kind of licenses are required. Typically there'll be one small office somewhere in Delhi or one corner of Hyderabad, but these trainings are not happening there. They're happening in hotels, they're happening in resorts, they could be happening in somebody's clinic somewhere. So it's very, very hard to regulate. And that is why our association is hoping that, by doing these kind of awareness activities, we would be able to warn these people, these young BDS professionals, these are young MBBS and Ayush professionals, not to spend their valuable money and time and effort in acquiring this, because these are of no consequence. They're not going to make you a legit practitioner under either the NMC or the DCI.
As it stands now, what is the regulatory mechanism in place to look after such clinics? What happens when somebody starts such a clinic? Are they flouting the law? Are the patients who go there, do they have any safeguards at all?
Their safeguards do exist. See, in India, it depends on, health is also a state subject. So the clinical establishment rules vary from a state to state, but the common thing here is that there is going to be a licensing authority. In Telangana, we call them the district medical and health officers. In Tamil Nadu, there is someone called the joint director of health. So these are people to whom, if I want to start a clinic in Tamil Nadu, then I will have to apply to their office, and then they will send an inspection team. They will check if uh, my medical qualification is recognized in India, it is valid. They'll check the premises, the infrastructure, and then they will give me a license. And one unfortunate thing that's been happening is some of our own people, our own medical professionals, are sometimes lending their certificates, or sometimes they are getting conned. So let's say there's a young dermatologist who's hired by a clinic, and they say, we're going to call you when we have patients, and then they get paid per consultation, but then the clinic is using their credentials to get a license. And we had to rescue such people. We had a young dermatologist in Hyderabad who had innocently given her credentials to one clinic, and then she was given a notice by Telangana Medical Council because when they went for inspection, she was not around, and there were technicians who were performing PRPs, and there was a chance that her license could have been cancelled actually because of something like this. And of course, we represented on behalf of the association, and we got her out of this. But these kind of risks are there. So one of the big problems is that, sometimes they give a fake certificate. And in India, our people, our population versus the number of government officials who are, who are able to do the checks, and the number of checkpoints, they're not really at par. So that is why sometimes, either a fake certificate is used or a real certificate is used, but it is used fraudulently. Now, what does a patient um, got to do with this whole thing? What can a patient do to safeguard themselves? And in case something has gone wrong, what can they do? They can very well complain to the state medical council, to the health authority whose jurisdiction this particular clinic falls under. So in Hyderabad we have 3 DMHOs. So depending on where it is located, then the patient could go and complain. And of course, the Consumer Protection Act is also there. And also, if somebody is convinced, the patient, now let us say I am a Ayush professional, but then I convince someone that I am actually a practitioner of modern scientific medicine, and that I am authorized to do, let us say, Botox or fillers. And then this patient can actually file even a criminal complaint. Criminal complaint on the grounds of, because this is like impersonation, this is like fraud. So there are various mechanisms by which patients can get redressal. But the sad thing is, how many people have the financial, the emotional resources and the logistic resources to go this far? It's most people just give up.
What is the NMC stand on this? You said that the Dental Council of India has been allowing professionals with postgraduate degrees. But what is the National Medical Council's stand on this? Are they at loggerheads with the Dental Council of India, or are they okay with this happening?
So, a very interesting question. Thank you so much for bringing this up. So, the Dental Council of India also has allowed only MDS, oral and maxillofacial surgeons. So, that is the OFMS, only that specialty people to get into hair transplant and facial aesthetic procedures. Whereas, what the NMC has done is they gave their public notice in the September of 2022, 20th September to be precise. And very recently, the Telangana Medical Council has written to the NMC and asked for a clarification on this matter, the very question that you're asking. And what the NMC has said is that the Dental Council of India has not approached them, has not sought their opinion about this. And that is where the NMC stands as of now. So we dermatologists, through our association IADVL, which happens to be the second largest association of dermatologists in the world, we have 18,000 members. So we are approaching the NMC for clear cut guidelines for more clarity.
How is this, all of this, the lack of regulatory mechanisms, the courses that have no oversight over them, and all, how is this putting people at risk? Is there a risk over here?
They certainly are. That is something that we have sadly learned from the two deaths that happened in Kanpur earlier this year and late last year. So, but you don't always have to end up in such a big problem, also. There could be so many things that could go wrong that people like me treat on a daily basis. Things like topical steroid damaged face. So that means, when you don't know what exactly the skin condition is and what the effect of a steroid cream used in the long run on the face is, then it is easy for such a person to prescribe a cream or do some kind of a treatment that is not good for the patient. So from minor things like a post acne mark, a minor scar, to serious things like loss of vision. Sometimes if fillers are not done properly, you could have skin necrosis, you could have the tip of the nose falling off, you could have damage to uh, some nerves in some cases, complete loss of vision, partial loss of vision. So many things can happen. So, and of course, some patients get addicted to the steroid creams, and we dermatologists struggle to get them out of it. Then some patients could have serious side effects because of the medications that are prescribed by unqualified people. So we recently had a patient who was being treated for something called lichen planus. It is an inflammatory condition with a immunosuppressant drug, which is not a bad treatment, but then it was not uh, given in the right dose, and he had to be admitted in the ICU, and we almost lost him. So there can be serious things that can go wrong.
Final question, Doctor. Tell us, what do people need to know? As you said, there has been an explosion in this industry. A lot of it has to do with the fact that people want to look better, people have that desire, people have those aspirations, and also it's also about self care, isn't it? People really want to take care of themselves, their skin, their bodies. So now, keeping this in mind, when all of us want to do it, all of us want to look our best, what do patients need to know if, say, if for instance, I wanted to opt for like a laser treatment or a hair transplant? What do I need to know? Who do I need to go to? And how do I check to ensure that the clinic that I'm going to is a correct one?
Excellent question. Probably the most important question of all that we have discussed. So, first thing, you need to ascertain the credentials of the person who will be performing the treatment, not just the person who's just doing the consultation. So, you want to make sure that if it is a hair transplant, there are some kind of a facial aesthetic procedure. At this point of time, you obviously want to stick to a dermatologist or a plastic surgeon. Now, suppose you want to go with what the Dental Council of India is saying, and at this point you want to go with a MDS OFMS, then at this point it is not illegal in most states. So that is something dubious. So you could make the choice, but let it be a very, very conscious choice whether you want a dental professional to be doing your hair transplant. But please make sure that this person has whoever is providing your treatment is registered with the NMC, and their postgraduate degree also is registered with the NMC. Now, lots of times we have someone who's done their MBBS in some country, some Russia, Ukraine, wherever, and then they do have a MBBS, they do have a MD, but then they might not have cleared their licensing exam, which foreign medical graduates are supposed to do, or maybe their MBBS is recognized but their MD is not. So you want to look at it. It is a patient's right to ask for the doctor's credentials. In fact, many of us actually display this. It is not mandatory to display it, but it is mandatory for every prescription to carry the registration number. So if it is a medical professional, then we have a MCI number or the State Medical Council registration number, and all my prescriptions need to carry that, and all patients need to be given a prescription. It can't be some chit of paper or a tissue on which I scribble and give. It has to be a proper document. It could be printed, it could be handwritten, that's all right. Now, if it is a dental professional, then that person should be quoting their dental registration number, the DCA registration number. So make sure that is there. And when you go to the internet, and if you go to the NMC register, then suppose I give my number as 12345, and then you put the one NMC register 12345, then there might be multiple people with that, but you should be able to find my name in there. And if you're not able to find that name there, then you will have to be suspicious. Also, you want to make sure that the clinic is licensed, and the clinic is licensed using my credentials or the healthcare professionals' credentials. It cannot be that I am doing your treatment, but the clinic is licensed in somebody else's name. So you want to make sure that the licenses are valid and there is no fraudulent use. Now, all this, saying it was easy. It is very difficult for a patient. Sometimes it can be misconstrued by professionals as, are you challenging my authority or my credibility or things like that. So it can be a little difficult. But then I think thanks to all these kind of incidents that have happened, most of the professionals these days are able to accept these kind of questions. And I think it's a question of the patient's right. So if somebody asks me, first of all, generally people don't ask because we already have these kind of things displayed. And the problem arises when you go through the social media. And social media is a place where there is such a big crowd. There's so much of information which is available, which is and it's very difficult to remove the clutter and get to the actual crux of the matter. So you will have to be all the more vigilant if it is just someone you met on Instagram, you saw on on some kind of a social media, and then you're going for a consultation based on that. So basically the final message is be vigilant, use the resources that are already existing, and of course, hopefully we will be able to get better regulation. We are looking at a QR code system. Many of the medical councils have already implemented a QR code. Like the Maharashtra Medical Council has a QR code system where you can scan that and it will take you right to that particular doctor's registration page. Hopefully we will all be able to get there soon.
Thank you so much for speaking to us today, Dr. Rajetha.
Thank you, Zubeda. It's been a pleasure.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.